Hi, this is Dr. Bhargava. This is the next video in the series Body Imaging Case Review. Here's our first set of patients. I'm showing you sagittal image of the spine in 4 different female patients. And these are different patients. The images are in the bone windows to appreciate the bone density as a patient ages. So the image on the left is from a 25-year-old female, next 45-year-old female, 65-year-old female, and then 85-year-old female. So we can see that the bones progressively are becoming less dense, and we can see that close to the end plates right here and right here, leaving this hyperdensity which is linear in the middle of the vertebral body. That's characteristic of osteopenia and osteoporosis. And at the level of L1 vertebral body, if you make a region of interest and calculate the Hounsfield units, and if it is less than 100, it is very certain that if the patient had a bone density scan, they will have osteoporosis. So that's the criteria I frequently use in older postmenopausal women. At the level of L1 vertebral body, in a sagittal view, I find the most lucent area in the bone and measure the attenuation. If that attenuation is less than 100 Hounsfield units, I say in my report that the patient is likely osteoporotic. This is our next patient, and they presented with a lump in the scrotum, and we performed an ultrasound. So long axis view of the right testicle showing no masses, long axis view of the left testicle showing no masses. So the the classical teaching is that intratesticular masses are more likely to be malignant and extratesticular masses are more likely to be benign. So there is a heterogeneous hyperechoic mass that is seen here and measured, and this mass is lateral to the right testicle, and they're showing it to us in a long axis view. And the color Doppler image shows that there is some blood flow inside this mass. So this is a hyperechoic mass adjacent to the right testicle. And so what benign pathology could this be? This one turned out to be a lipoma of the spermatic cord, a very common tumor that arises from the spermatic cord. Lipomas are hyperechoic on ultrasound, and this is outside the testis but inside the scrotum. Here is another patient who presented with abdominal pain, and a CT of the abdomen and pelvis was performed. We find the findings suggestive of a ruptured hepatic cyst. So here's the cyst in the liver occupying most of the right lobe, also seen here. And the cyst has ruptured into the subdiaphragmatic space with extrusion of the fluid inside that we see here. And also seen right here in the subdiaphragmatic region, and also free fluid in the pelvis. So a good example of a ruptured hepatic cyst. These patients or this pathology is usually self-limited. The two walls will come together and join over a period of time, leading to a smaller cyst in the liver, and the fluid in the abdomen will get reabsorbed. Sometimes this event, the rupture, can lead to bleeding as well, hemoperitoneum, and in that case, if the patient becomes hypotensive, then they may be a candidate for surgery. This is our next patient. There are 2 different chest x-rays from the same patient. They have a small pneumothorax that we were trying to treat by putting in a chest tube. And so as we follow the chest tube, we find that the tip is somewhere here, but the side hole is outside the chest wall, and it is better seen right here. And so this side hole should be inside the chest wall, but because it's outside, the air is leaking into the chest wall, causing this soft tissue emphysema extending from the neck and involving the right lateral chest wall. The pneumothorax is not seen anymore on this follow-up chest x-ray. Here's our next patient, and this is a great example of malpositioned central venous catheter. A left-sided internal jugular venous catheter was placed, and we see that the tip, instead of going this way into the SVC, and the tip normally should be at the level of the cavoatrial junction right there, it is gone to the other side, probably in the subclavian vein or in the soft tissues. So if you see something like this, please let them know immediately to remove this and replace the catheter. Here's our next patient. We performed a whole body bone scan on this anterior and posterior projections. We find that there is diffuse increased uptake in the right hemipelvis, with expansion of the bone seen in the anterior and posterior projections, consistent with Paget's disease. This is an older patient because we see uptake in costal cartilage calcifications that happens with age, and there is no evidence of osteoblastic bone metastasis. Let's go back to that patient. What we missed here earlier is this photopenic defect projecting over the right thigh, and this turned out to be a large lipoma on their CT. The CT also shows the bone expansion and heterogeneous trabeculation involving the right hemipelvis, again from Paget's disease. Here's our next patient. They presented with a thyroid nodule and they were also clinically hyperthyroid. So on this long axis view of the left lobe of the thyroid, it looks normal. On the right side, we see a nodule which shows peripheral hyperemia, central blood flow, and they have measured this nodule. Here again, the transaxial view of the left lobe of the thyroid showing that there are no nodules. So there is a nodule in the right lobe of the thyroid because this patient was hyperthyroid. We also performed a I-123 iodine uptake and scan on this patient, and this is what we found. The uptake value is elevated at around 63%. There is increased uptake in the right lobe of the thyroid, and there is no or suppressed uptake in the left lobe of the thyroid. So this patient can be treated or is a good candidate for I-131 treatment. Whatever or 63% of what you give orally to treat this patient in form of I-131 will go and treat this nodule, and over a period of time, the normal uptake in the left lobe of thyroid will come back, making this patient euthyroid. Here's our next patient, and we have performed a CT with and without contrast looking at a complex cyst in the left kidney. And so on this delayed images, we find that there is normal enhancement seen in the right kidney and excretion of the contrast into the collecting system. And we see some of it in the left kidney, but then we see this exophytic complex cystic mass that shows parts that are cystic and parts that are solid and enhancing, suggesting a Bosniak 4 cyst, likely a renal cell carcinoma. Here is our next patient. They presented with high PSA and we performed a prostate MRI. So on the top we have axial, coronal and sagittal small field of view T2 weighted images showing a focus of low signal intensity in the left peripheral zone of the prostate, also seen right here and here. This focus shows high signal on DWI and low signal on ADC, consistent with prostate cancer. So this patient underwent a prostatectomy and sometime later presented with rising PSA, and that's when we performed a PSMA PET CT. And we will start by looking at the rotating image. We see physiologic distribution in the salivary glands, liver and spleen, excretion from the kidneys into the urinary bladder, and these two foci of abnormal uptake. And so these two foci correspond to this sclerotic bone metastases seen here, and also a lymph node that is para-aortic seen right here, consistent with metastatic disease. This is our next patient. They underwent a PA and lateral view of the chest, and we see the classic findings of nipple shadows. So I will outline the right breast and the right nipple, and then I will outline the left breast and the left nipple, and on the lateral image we find the nipple shadow right there. So nipple shadows are frequently seen, especially in females. They may be seen only on one side, and sometimes, like here, seen on both sides. They can be confused with lung nodules, and sometimes a follow-up CT is performed. And here's the companion case where a abnormal density was reported on this side. I will outline the density right here, and then I will outline the breast shadow. And so a nodule was suspected and a CT was performed. On the scout image, we don't see that density, and on the transaxial images, there were no lung nodules, but these large nipples seen bilaterally. Here's our next patient. They presented with chest pain and we performed a chest x-ray. We see this large opacity abutting the chest wall in the left upper lung zone. And so the next logical step in this patient's management would be a CT scan of the chest. And a CT scan showed this large heterogeneous enhancing mass in the left lung apex, which is invading the chest wall. So a locally advanced lung cancer was diagnosed. Here's our next patient. They presented with a swelling of the scrotum. We performed an ultrasound where on this image on the left, I'm showing you no focal lesions in the right or the left testicle. And inferior to the left testicle in the long axis view, we find this complex cystic mass with peripheral hyperemia suggestive of an abscess. Here's a corresponding CT scan. More anteriorly, we see the normal testicles and some reactive hydrocele. More posteriorly, we see this complex cystic mass involving the scrotum, consistent with the abscess that we saw earlier on the ultrasound. Here's our next patient. The history that this plain film came with was foreign body, and so there are 2 foreign bodies, likely buttons or small magnets swallowed by this patient. And so frequently we want to localize these. These are in the bowel loops projecting over the right lower abdomen, and frequently we follow them over a period of time to make sure that they are excreted in the stools. We are also looking for any signs of bowel obstruction in these patients. This is our next patient. They presented with a vulvar mass. The mass was biopsied and a melanoma was found. Here on the top we have short axis T2 weighted images on this patient, sagittal, coronal, and axial. This is the vulvar mass, also seen right here and here. Melanomas usually show T1 hyperintensity and enhancement, and that's what we see here. And since melanoma is a malignancy, it will show restricted diffusion, so high signal on DWI, low signal on ADC. For whole body staging, this patient underwent a FDG PET CT scan. Here is the rotating image where we find that the vulvar mass is FDG avid, seen here, and there is focal hypermetabolism and bilateral inguinal lymph nodes, which is also seen right here, suggestive of metastatic disease. This is our next patient, and the interesting finding is this linear hyperdensity projecting over the cardiac silhouette. This chest X-ray finding on a corresponding CT or corresponds to mitral valve calcifications on the CT, also seen here, very characteristic. Here is our next patient, and they presented with chest pain. A chest X-ray was first performed, and we find that there is mass effect on the trachea. There is a mass in the medial aspect of the right upper lung zone. They need a CT. On the CT scan, we see this locally advanced mass narrowing the branches of the pulmonary arteries, and also the airways. So a locally advanced lung cancer was diagnosed. Here's our next patient, and we performed a CT of the abdomen and pelvis. The findings are in the chest, so at the edge of the field of view, there are post-surgical changes. The history was esophageal cancer with esophagectomy and gastric pull-through surgery. We find multiple bowel loops in the chest. One small bowel loop is opacified with contrast, and so on these images it's hard to figure out the findings, but what this patient had was a paraconduit hernia, and here is a line diagram showing post-surgical changes from esophagectomy and gastric pull-through. And after the surgery, because the diaphragmatic hiatus is large, a bowel loop can herniate into the chest, and that's what we see here as a paraconduit hiatal hernia. This is our next patient, a young pregnant woman who was recently diagnosed with cervical cancer. We can see vertex presentation and the brain of the baby right here. Cervix is right here on the sagittal small field of view T2 weighted image, and here is the heterogeneous mass in the axial and the coronal projections, and the mass shows restricted diffusion seen right here as high signal on DWI and low signal on ADC images. So an example of cervical cancer presenting during pregnancy in a young female. This is a patient who underwent a barium swallow for suspected obstruction post surgery and radiation, and here we find that there is stasis of the contrast in the upper esophagus, and on the frontal projection we find that there is narrowing of the esophagus. So it's a post-surgical stricture in the upper esophagus that was diagnosed on a barium swallow on this patient. Thank you for watching.